Imagine you're sitting in an airplane, 30,000 feet above the ground. You're watching the mountains and the valley and the river below. You can hear the roaring of the engine, and you can feel the turbulence. And you hear the captain asking you to put on the seatbelt. And you know what's separating you and the mountain below is a layer of metal, the machines and the engines below that. But you really don't worry about it. You go back and watch your movie or listen to your music. What makes you feel safe? What makes you to believe that this airline is going to fly you through or carry you through the turbulence and get you to the destination safely? It's one word: trust. Before you got on the plane, you did not check the engine. You didn't question the captain or the crew. You just believed and trusted the airline to fly you safely. Imagine a world where we can trust each other, feel safe, and live peacefully. As a cancer doctor, I know that you will not trust me to fly you anywhere, but I hope you'll trust me to heal you. At first hand, I know that building a trusting world is a matter of life and death. So in the next 10 minutes, I'm going to tell you stories of 3 amazing women who taught me the lessons of the power of trust. First, let me introduce you to Cindy. I met her about 20 years back. She was a 34-year-old mother of 2 boys, an 8-year-old and a 10-year-old. Her boys wanted to be a marine biologist and an aerospace engineer. And she was working full time, and she had no time for cancer. When she felt the lump in her breast, she knew something was wrong. She had biopsies and scans and tests which confirmed a stage 3 aggressive breast cancer. She was my first patient when I started to practice as a cancer doctor. I had just finished my training from the National Cancer Institute, which is one of the best cancer research centers in the world. I had just published a textbook on cancer treatment. So I was fairly confident that I knew how to treat Cindy's breast cancer. But I was completely wrong. She came prepared with questions. She had a thick notebook. She had papers and pencils and highlighters. She grilled me for an hour. I didn't have all the answers, but I was prepared to find the answers for her. She shared her story, her dreams and hopes for her boys. She talked about her hectic work schedule. She talked about her family. At the end, she started the treatment. She even enrolled on a clinical trial. She did everything I asked her to do. Even after 20 years, she still comes to see me. She drives 6 hours for our 30 minutes appointment. Of course, we talk about cancer, we talk about her health, but we mostly catch up on our lives. Cindy made me a better doctor. How did we build trust? I made time to listen to Cindy's stories. As a well-trained cancer doctor, I knew how to treat her breast cancer. But by listening to her stories, I knew how to treat Cindy. Building trust is a matter of life and death. Now, Let me introduce you to Maria. She was a 54-year-old mother of 4. She worked in housekeeping at various places, including hospitals. She had a car, she had insurance, and she had a cat named Kitty. When she started feeling her lump in her breast, it started to grow and started to bleed. She knew it could be cancer. She was living only a few miles from large hospitals. She could have easily access care. She tried to see a doctor early on when the lump appeared, but her experience was not pleasant. She didn't find someone who will listen to her. So Maria's experience was not in isolation. In fact, studies have shown that doctors interrupt patients every 16 seconds. So she never bothered to go back. When the tumor kept growing, it started to bleed, and it started causing intense pain. That's the time she came to see me. We talked about her life, we talked about her family, we talked about her cat. When she talked about her son who is in the Navy, her eyes lit up. She talked about her mother who died from dementia whom she took care of for many years before she died. By the time she came to see me, you can see that the cancer already spread all over her chest. It spread to her liver. It was too late. What delayed her diagnosis? What caused Maria's eventual death from breast cancer? It was lack of trust. As a health system, we failed to earn Maria's trust. So building trust is a matter of life and death. Now, let me introduce you to Sylvia. I have been taking care of Sylvia for the last 15 years or so. She had a stage 2 breast cancer. She had chemo and surgery and radiation. She's doing really well. After completing her standard treatment, she even enrolled on a clinical trial. She took a pill for 1 year, part of her study. She's doing really well. She just recently came to see me. So before leaving the room, she kind of waited and paused. And she asked me, "Doc, what do you think about the COVID vaccine?" I was shocked. This is almost 2 years into the COVID pandemic. More than billions of vaccines are taken by people around the world. I said, "Sylvia, 15 years back, I walked into your room, talked about a new medicine, which is barely taken by 1,000 patients around the world. And you just took that medicine. You didn't question me. You just took that medicine. Now this vaccine, which is tested in more than 500,000 people around the world and found to be safe and effective, it is taken by billions of people around the world. Why are you hesitating?" She said, "I just don't trust it." We lost more than 300,000 patients or people because they didn't trust the vaccine. They did not believe COVID was real. And today, we reached a grim milestone of losing more than 1 million patients dying from COVID. That's the highest in Western nations. It's easy to build hospitals and vaccines, but it's not easy to build trust. Building trust is a matter of life and death. As a cancer doctor for more than 20 years, I believe building trust is the cornerstone of any relationship, especially doctor-patient relationship. Patients are not broken machines. It's important to treat, but it's more important to heal. The world runs on trust. The three cornerstones of building trust: it's important to listen to stories. Stories connect us at a very human level. Be honest, accept our weaknesses, our vulnerabilities, and show you care, your kindness, your compassion, your empathy that earns credibility. Trust is the oxygen of the healthcare system. So patients have the highest stake in earning the trust, but doctors have the highest responsibility in building the trust. So whatever you do, students, or whomever you are, sons and daughters, students, teachers, I hope you will join me in building a trusting world by listening, by caring, and by being honest. Thank you.